So this report comes as 4 Arizona counties are now meeting the benchmarks for reopening to in-person learning. So what will this mean as the school year unfolds? Joining us now is researcher and cardiologist, Dr. Ernst von Schwarz. Doctor, thank you so much for joining us this morning. Also, we're learning that kids can carry the COVID-19 virus for weeks and potentially showing no symptoms, but obviously that means that they can spread to relatives and adults who are in their lives. So please let us know, top of mind, what do you find most disturbing about this, and is there a silver lining, because still we know that most children do not suffer severe symptoms?
Good morning, Olivia. Thank you for having me. And you're absolutely right. Of interest, within the last month, nationwide, the number of children infected with COVID raised 90%. So even though, as you mentioned, the hospitalization rates are relatively low and the mortality rates are low, I mean, there's still children dying from the disease. And it's not that they are immune, of course not. Even though oftentimes the symptoms are milder than in adults with underlying serious health conditions. But we all have seen children getting really sick. And the fear from our side is that they can develop a condition which is called the multisystem inflammatory response in children, which is usually presenting with high fevers, over at least 24 hours, with 2 organ systems involved, with breathing problems among other symptoms, and that requires hospitalization and could be a long-lasting, even fatal disease.
Doctor, what are the first symptoms then to be looking for? Obviously, we've seen those images of the rashes and the COVID fingers and toes. So I imagine skin variations, but still is fever the #1 symptom to look for? And also, what do you recommend regarding testing for our kids before they go back to school and maybe a couple of weeks into the school year if they're on campus? Is the saliva test still maybe the best option for kids, and how reliable is that?
Yeah, Olivia. So the symptoms are what we call non-specific. You're right. Fever is the #1 symptoms. Runny noses, breathing problems, cough. In kids, especially in younger kids, oftentimes there could be abdominal symptoms such as diarrhea, abdominal pain, bloating. We have seen that too, but fever is the #1. With regard to the testing, yes, the swab tests, ideally in the nose or in the mouth, which tests for the antigen, is for adults and for kids the best test to detect if someone is currently infected with COVID-19. So the recommendations are a little confusing, because just a week ago the CDC recommended, not everybody needs to be tested who was exposed, including children. On the other hand, the recommendation had not changed with regard to that everybody has to be quarantined who was exposed to someone with COVID-19. So our recommendation is, if children or adults are exposed to someone who is sick with COVID-19, you definitely should get tested. And the test accuracy is relatively high, with a 95% detection rate.
Dr. von Schwarz, thank you so much. We will leave it there. Also, the head of our state health department also recommends to continue to be tested should you find out that you have been exposed to COVID-19 here in Arizona. Thank you so much for your time, sir.
Thank you, Olivia.